Before we start, we'd just like to remind you that the information on this webinar is not meant or applied to be a substitute for professional medical advice, diagnosis, or treatment. Please consult with your physician or dentist for any further questions. Our today's topic is Oral Health 101. We are very honored to have Dr. Jeffrey Ziar to our lecturer. Dr. Ziar is my friend, and we all graduate from Columbia University. But he is the very outstanding dentist in Columbia University. Got the perio programs in degrees and in Columbia. And he also helped Tzu Chi so many outreach and in different dental clinic in New York City. So we appreciate that we have Dr. Ziar to be our lecturer today. Dr. Ziar, do you like to say hello to everyone?
Yes. Hi, I want to thank Dr. Yan for the kind introduction, and I want to thank Tzu Chi for organizing today's event and also for the invitation, and also thank all the participants for taking the time on a nice Sunday afternoon to listen to the presentation. So today I'm going to talk a little bit about some of the more common dental diseases and what we can do to prevent them. So as Dr. Yan mentioned, I am a periodontist. I'm currently practicing in Manhattan, and I did my dental training at Tufts University in Boston and my periodontal training at Columbia University. And so with all that, I think we can get started. So why do we want to maintain a good oral health? So mainly we want to do that so that we can look good, we can have a nice smile, we can speak properly, we can then eat and enjoy our food properly, and in return we can have a nice and overall health. So we are all living longer, as according to the 2020 US Census, there are over 16% of the population that are over 65 years old. And that trend, it's going to continue to increase. So nowadays, people living into 70, 80, 90s, or even 100 are becoming more and more common. So as they live longer, that means they need to maintain their teeth longer. So we as a dentist, we also need to help them to maintain their teeth longer. So just a little overview of some oral dental anatomy. So all teeth, as we all know, are supported inside alveolar bone, and the bone is covered by the gum tissues. And within the two structures, you have the outer layer called enamel, the second layer called dentin, and the inner layer called the pulp, which contain all the nerve, all the blood vessels, and some connective tissues. So that means when you have a toothache, when you have a dental pain, the pain can be either coming from your teeth or it can be coming from your gum. So when you have a tooth problem, the most common are cavity. So, and with the gum, you have red, inflamed gum tissues, bleeding, which we're going to go over in a little bit more detail later. So as we all know, the mouth is full of bacteria. So there are over 700 different kinds of bacteria in the mouth and over 20 billion bacteria in the mouth. So some of them cause cavities, some cause gum disease, and they reproduce rapidly. So on average, about every 5 hours. So if you go 24 hours without brushing, then the bacterial load going from 20 billion to 100 billion. So that's why it's important to maintain daily oral health, brush and floss at least twice a day, which we'll go over a little bit more in detail later as well. So what is a dental caries or a cavity? So basically a cavity is a demineralization of the two structures. So certain bacteria in the mouth the most common one called Streptococcus mutant. So they will take simple sugar and turn that sugar into acid, and then the acid will then demineralize the enamel or the tooth structures. So that's what a cavity is. And that's the reason why when you go and get your dental checkup, your dentist will pick up this sharp, pointy, scary looking instrument and keep poking on your teeth. So what they are trying to do is to detect any softness on the enamel, which is an indication of a cavity. So when you have a cavity, what are some of the symptoms? So you might experience some sensitivity to cold. When you eat ice cream, drink an iced coffee, you might feel a little soreness, sensitive to sweet, or sometimes when you chew, it feels a little sensitive or tenderness. So when the cavities are small, you can, the treatment is just to get a simple filling or sometimes a crown to correct the problem. So this diagram just illustrates what we just said. So when a cavity started to develop on the enamel, at the beginning, it started to demineralize the enamel. And as it gets bigger, as long as it's still in the enamel, there will be no symptoms. But if those cavities have not been treated and start to expand and spread into the second layer, which is the dentin has small tubules that connect to the pulp, which contain all the nerve tissues inside. That's when you will start feeling some sensitivity to cold and to sweet. And if that cavity is still left behind and not being treated, it will continue to get bigger. And then the cavity will start to spread into the third layer, which is the pulp, which contain all the nerve and the blood vessel. That's when you will develop some pretty serious pain. And those bacteria will spread through the canal and exit at the tip of the root, we call apex, and start spreading the infection into the bone. When that happens, then you will develop an abscess. So some of the symptoms, once that develop, you will not only experience cold sensitivity, you may also experience sensitivity to heat, to hot. And also you will, might taste some metallic taste in the mouth, and then you're going to see potentially you can see a little kind of a pimple-looking structures on your gum. So that is an abscess that developed inside the bone and needed a place to drain. So with that, then treatments may include either doing a root canal or doing a tooth extraction. So what is a root canal? So as we said, when you have a cavity that extends deep into the nerve, like it shows on this X-ray, this dark area is an indication of the cavities. Then the nerve that is inside the canal will need to be cleaned up and then filled with a root canal sealing material to block that tubule so that the bacteria can no longer spread through the canal and infect the bone. So those are some of the more common dental tooth-related problems. So what about the gum? What is a periodontal disease? So periodontal disease is a chronic disease, is a chronic inflammation that are bacteria-based that cause inflammation and infection of the gum and the bone surrounding the teeth. So the bone and the gum is the foundation of the teeth. So that is important. If the foundation is not good, no matter how beautiful a crown or filling that is placed on top of the tooth, it's not going to last. It's just like building a house on a weak foundation. It looks beautiful, but once you have a storm, the house is going to fall. So periodontal disease is one of the most common infections in the United States. Over 75% of an adult in America over the age of 35 have some type of gum disease or periodontal disease. Whereas people with more severe gum disease, over 40% of people over 65 years old has a severe gum disease. So how do we test gum disease? So that's when you go to the dentist again, and they pick up another sharp instrument and start poking on your gums. So what they're trying to do is to measure what we call a periodontal pocket. So between all the teeth, And the gum, there's a small space we call periodontal pocket. When it's healthy, you want to maintain a very shallow space of less than 3 millimeters. Because if any food or bacteria that get trapped under the gums and not being removed on a regular basis, those bacteria will cause inflammation. And when the gum is inflamed, the gum swells up, pockets get deeper, more bacteria go inside, more food can go inside, and then it becomes almost impossible for you to maintain on a regular basis. Over time, those bacteria will start to destroy the bone that is supporting the teeth. And when it becomes very severe without the bone, that's when the teeth become loose. So gum disease is, as we said, one of the most common diseases, and there are very limited symptoms. In the initial state, you may not feel any pain. You may not see a lot of signs of an infection until it becomes too late. So what are some of the signs and symptoms of gum disease? So bleeding gum, that is probably one of the most common symptoms that you will see. So when you floss, when you brush, sometimes if you do see bleeding, some patient comes in and they say, oh, I see some bleeding. I think I'm brushing too hard. I'm flossing too hard. It can, but most of the time, the gum bleed when you floss and brush is because of inflammation. So when there are bacteria trapped under the gums, those bacteria causing inflammation as the body is trying to fight off the bacteria, they bring in more blood vessels. That's why you see the bleeding when you floss. And instead of avoiding those areas, you actually need to spend more time, floss more, brush more, to limit the bacteria load in the area. So the better you maintain, the less bleeding you will see. So red and swollen gums. So if you look at your gum tissues, you see that, oh, it's very puffy, it's very bulbous. So that's also a sign that you have some type of gum disease. So again, when you have a thick gum tissues, there are a lot of spaces underneath that the bacteria and the food can trap, then ultimately will cause more severe gum problem and bone loss. Bad breath. I'm sure your friend, your spouse, your kids will not appreciate if you have bad breath. And so that is also a sign that you have some type of periodontal disease most of the time. So I'm sure a lot of you are aware that other problem like the GI problem can also produce some bad breath, but coming from the mouth dentally, it's a more common reason of having bad breath. So when the teeth started to shift, when the teeth started to become loose, that's also a sign that you have periodontal issues, because as you have less bone, the teeth have less support, so the teeth will start moving and your occlusion, your bite is going to start changing. Now, when you see pus coming out from the gum, that's when it becomes a little bit more severe. So that is also a sign that you have more severe periodontal issues. Gum recession. So when you notice that your gum is receding, so showing more of the root surface, that is also a sign of periodontal disease. So since the gum covers the bone, so as you lose the gum, you lose the bone. And if it continues to get worsened without the bone, the teeth is going to start getting loose. And for those who are wearing a denture, whether it's a complete denture, partial denture, if the denture, especially partial denture, if the dentures are starting to get loose, that means your teeth are moving, your bones are shrinking, and that is a sign that you also have a more increased periodontal issues. So what do we do when we have periodontal disease? So since the cause of all the periodontal disease are bacteria-based, so the main goal is to reduce the bacterial load in the mouth. And you can do that by increasing better home care, getting regular checkup with your dentist for your cleaning, or scaling and root planning, as some people call it, deep cleaning. So the goal of cleaning, the 6-month cleaning or the scaling, is to remove any bacteria buildup. So when it's soft, it's called plaque. So plaque, it's a combination of protein in the saliva with bacteria. They are soft, so you can easily remove it by toothbrushing or flossing. But once the plaque stays in the mouth for a few days, the saliva will start calcify the plaque, and turn the plaque into what we call calculus or tartar. So that is a hard material that attach onto the tooth surface. Once they become calculus, then even if you try to brush, you cannot remove it. That's when you need to go to the dentist or the hygienist to remove those calcified bacteria. So when it becomes more severe, it can build up a wall on the teeth that you cannot even put a floss in between. And from this picture, you can actually see once you have the bacteria load, the tissue gets very inflamed and red. And then once the calculus or the bacteria are removed, the tissue becomes a lot healthier and pink. Okay, so that is more when the problems are all in the soft tissues. So what happens when you have more severe gum disease? When you have bone loss, for example. So on this X-ray, you can see on the top X-rays, the black triangle, the space, is a sign of bone loss. So certain type of bony defect, we can help to, there's treatment that can be done with bone grafting to grow back the bone that is missing. But anytime when you start having bone loss, that means the bacteria is already spread inside the bone. So most of the time, you will need to have some surgical treatment to correct the problem so that the bone can be cleaned, the infected gums can be surgically removed. So what happens when you have gum recession? So when you have gum recession, there are procedures called soft tissue graft, and there are many different types of soft tissue grafting. So today we're not going to go into detail on that. But in general, there are procedures that can be done to grow back the gum that is missing. So the main goal is sometimes not just to cover the root, but to gain back the protective zone so that you have a thick protective gum tissue to protect the underlying bone. You can picture kind of like driving a car with no bumper. So you're adding a thick bumper so that you can protect the body of the car. In the mouth, you can protect the underlying bone. Now, when you have overgrown gum tissues, as we said before, when you have overgrown gum tissues, a lot of spaces can be there to trap bacteria. So there are surgical procedures can be done to remove those extra gum tissues so that the patient have easier access to maintain their teeth. Now, when the teeth become more severe, then the tooth may need to be extracted. Then when the teeth are extracted, there are different ways of replacing the missing teeth, and dental implant is one of the options. You can do a bridge. There are removable partial dentures that can be done. Now, so what will happen once the teeth is removed? Because the teeth are embedded inside the alveolar bone, and once the tooth is gone, the bones are not being used. So slowly the alveolar bone will start to get resorption. And then as it gets more severe, then you will only leave with a very thin basal bone. And that's why when you see some elderly people, when they're wearing a denture, over time, their face completely collapses because the alveolar bones are completely resorbed. And then the denture becomes very loose because they don't have a lot of surface for the denture to be seated. So that's why trying to preserve the bone after the extractions are important. So nowadays, dental implants are more common. So that is one good way to help maintain the bone, in addition to gaining function and aesthetic, and to replace the missing teeth. So what is a dental implant? So basically, dental implant is a fixed prosthesis that you can use to replace missing teeth by putting a titanium screw, which is the implant itself, inside the bone. So that implant will mimic the root of the teeth. Once it's integrated, then on top of the implant, the restorative component can be put on top of it, called an abutment, and then the crown can put on top of the abutment. So that is one way to replace the missing teeth with another tooth supported by a titanium post. So with dental implant, you can use it to replace one teeth, multiple teeth. You can use it to replace the whole arch, and it can be a fixed prosthesis, meaning you don't have to take it out at night, or it could help to improve stability on a removable denture. So this is called an overdenture by adding 2 or sometimes 4 implants that can help to, they can put a little attachment onto the denture so the denture is more stable. So since the mouth is part of the body, and any disease in the body can cause disease in the body, in the mouth can cause disease in the body. So now there are a lot of strong link between periodontal disease and systemic diseases. Some of them include cardiovascular disease. So people with periodontal disease have shown to have 2 to 3 times more risk of having a heart attack or other serious cardiovascular event. And people with periodontal disease have 6 times the risk of having premature labor, 2 times the risk of having a stroke, and uncontrolled diabetes also showed an increase in prevalence of periodontitis and the extent of periodontitis. Studies also show that if you have rheumatoid arthritis, you are twice as likely to have periodontal disease. And the inflammatory periodontal microenvironment can play a main role in developing rheumatoid arthritis. Cancer. People with periodontal disease have shown to have about close to 50% more likely to develop kidney cancer, 54% more likely to develop pancreatic cancer, 30% more likely to develop blood cancer, etc. Now, smoking, as we all know, smoking is bad for your overall health, but it's also very bad for your oral health. So smoking is a risk factor, and there is a 4 times, people who smoke have a 4 times likelihood to develop periodontal disease and 6 times to develop oral cancer. In fact, 90% of people with oral cancer do smoke. So that's one of the easiest way to reduce all the risk by simply stop smoking. So oral cancer. So there are many, many different oral pathologies in the mouth. So oral cancer is one of them. And the more common oral cancers are squamous cell carcinoma. Anytime when there is a non-healing ulcer in the mouth or any white lesions in the mouth, you should get your dentist, get your physician, or a pathologist to look at to rule out anything serious. So the more common area to develop oral cancers are on the side of the tongue and on the floor of the tongue. So usually they can be asymptomatic. You may just see some white lesion, we call leukoplakia, sometimes an ulcer. So whenever you go to your 6-month checkup, most dentists, in addition to checking your gums and your teeth, they will also do an oral cancer screening to make sure that there are no pathologies that is developing in your mouth. And if they are not, you can always ask and see if your dentist can also give you an oral cancer screening when you go for your checkup. So as we get older, we are more likely taking some medications. So it's great that now we have pretty much a lot of medicine that can help control a lot of diseases, but they all have side effects, and some will create dry mouth or overgrown gum tissues. So with dry mouth, then the teeth are not as lubricated, so more plaque tends to attach onto the tooth, and in turn that will increase your caries rate. You can have more susceptible to periodontal disease. So it is important to know what medications you're taking, what side effect they have, so you can prevent. So with a balanced diet is important for your overall health, but since you do need to have good dental health, you need to have teeth so that you can eat properly, so that you can have a better digestive system. So how do we maintain oral health? So the best way is to limit the bacteria by at least brushing your teeth, flossing your teeth 2 times a day. Have a regular checkup on average about 6 months. Now the 6-month recommended cleaning, it's actually not a random number. So it's based on a very extensive studies done many years ago, multi-center studies. So researchers, they looked at patients, they teach them how to brush properly, floss properly, have them go into the clinic every month, check for any signs of inflammation, the amount of plaque buildup, any bleeding when they probe, when they check the mouth. And on average, the time it came out is about 6 months. So no matter how well people maintain, in about 6 months, you will develop some sign of inflammation. And that's how the recommended 6-month checkup is developed. And again, those are for people who brush and floss well. So for people who doesn't maintain as well, or people that are more prone to cavities or gum disease, they might have to go and get their cleaning more regularly. Sometimes 3 months, 2 months, depending on individual. And so the dentist will advise you when they will recommend you to go back for your regular checkup and cleaning. So smoking, limit any alcohol intake, and also help to increase the oral health. Now, how do you brush? So when you brush, the main goal is to remove any plaque buildup, any bacteria buildup that is on the teeth and on the gum. So always use a soft toothbrush since plaque is soft. So you really do not need to use anything harder than a soft toothbrush. And when you brush, it's okay to brush longer, but not harder. Because when it's still in a plaque form, you can remove them. But once they turn into calculus, even if you brush extremely hard and with a really hard toothbrush, you still cannot remove it. So make sure you brush daily, floss properly daily so that you can remove them when they are still soft in a plaque form. So since the bacteria are all hiding along the gum line, so you want to angle your toothbrush at about a 45-degree angle, gently massage the gum by doing a small circular motion. So you are massaging gum, freeing up any plaque, any food, any bacteria that is trapped under the gums. And then you want to do that throughout the entire mouth, on the cheek side, on the tongue side, on your upper teeth, on your lower teeth. So on average, if you use a manual toothbrush, you want to spend about a minute per surface. So in the mouth, you have 4 surfaces, so you want to spend a minimum of 4 minutes. And electric toothbrush is also a good tool to use. Now, there are many, many different types of electric toothbrush in the market, and they are all great. So they all work much better than a manual toothbrush. And many, many studies have looked into the benefit of electric toothbrush versus manual toothbrush. So looking at any clinical signs of health, electric toothbrush are statistically significantly better than using a manual toothbrush. Whereas when they look at the different electric toothbrush, it's non-statistically significant. So what does it mean? So that means no matter what electric toothbrush you choose to use, it's still much better than using a manual toothbrush. So I do highly recommend people using electric toothbrush. Now, when you use an electric toothbrush, there's a little bit different as far as how to brush. So you need to give enough time for the vibration of the electric toothbrush to remove the bacteria. So you want to leave the brush, same thing along the gum line, the angle becomes not as crucial. Slowly in each spot, you leave for about like 3 to 5 seconds and slowly move from one tooth to the other rather than back and forth too quickly. So kind of like when you clean the floor, instead of using a broom, you use a vacuum cleaner, you have to give enough time. So slowly move your vacuum cleaner along the surface instead of going too quickly. And also same thing, you do not need a lot of pressure. Flossing. Flossing is important. Since toothbrush, whether it's electric toothbrush or manual toothbrush, they can only brush the outer and the inner layer of the teeth. But in between the teeth, the toothbrush cannot reach. So the only way to clean in between the teeth is to floss daily. Now, when you floss, any kind of floss will work just as well, whether it's a waxed, non-waxed, string-like, tape-like floss, anything, whatever works better in your hand that you feel more comfortable will work just as well. But when you floss, you want to picture the shape of the teeth. So teeth is not a square. So once you bring the floss in between the teeth, first you bring it under the gum because that's where all the plaques are hiding, under the pocket. Then you want to wrap the floss around the teeth, follow the curvature of the teeth. So you create like a C-shaped angle. Then you want to bring your floss up and down, back and forth, kind of like shining your shoes. So you want to cover all the surfaces on the teeth. Then you bring the floss to the back of the teeth, then you can clean the other surface of the teeth. So ideally, you want to floss twice a day, but at the minimum, if you can do it every day, once a day. Nighttime is the most important when you're both brushing and flossing, because when you're asleep, the body doesn't produce as much saliva. Then any bacteria that get trapped inside will be a lot more active and they adhere onto the tooth surface a lot quicker. So there are other tools that you can use. One of them is called proxy brush or interdental brush. So this is a good tool for people to use when they have big spaces between the teeth, or when people have bridge work, or if they have pretty severe arthritis, they really cannot floss the teeth. So using this proxy brush is a good way to clean in between as well. So water pick or water floss is also a good tool. So what it does is it uses water pressure to clean in between the teeth. But when you use a water pick, it has to be a little bit more careful because one, you do not want to set the power too high. So no more than half of the power setting. And the angle is important as well. You want to try to go as horizontal as possible. So you want to push the particles out, but you do not, but you do not want to point into the gums. So you do not want to push the particles further into the pocket. So it is a good tool, but it's a little bit more technique sensitive, but it's a good way to clean if you really cannot floss. And mouth rinses, they are also a good addition. So any over-the-counter mouth rinses, they all work extremely well, whether it's alcohol-based, non-alcohol-based. But whenever you use any mouth rinse, you have to rinse for at least 30 seconds in order to be effective. Now, dentures. So for people that are wearing a denture, so you never want to wear it to sleep. So whenever you sleep, you take it out. Whenever you don't use it, always leave it in a glass of water so you can keep the appliance moist. And they do need to be clean, even though they are really not your teeth, because bacteria can still hide and trap under the acrylic, under the prostheses. So gently, you can use a soft toothbrush, soap and water to clean. And there are tablets that you can use to soak the denture in to clean as well. And also make sure that your denture fits well, so you do not create any trauma on the gums. Now, if the denture get really, really loose, and no matter what the dentist do, they cannot fix it, it's still sliding around, so that can cause a lot of trauma on your gums. You can add some adhesive, which is like a glue, on your denture, so that helps to hold the denture in place. And these are my two little babies. So Charlie and Lucy. So not only do we need to maintain our own dental care, make sure that you keep your pet's teeth healthy as well. So this is Lucy when I first got her from the shelter. So as you can see, a lot of heavy calculus build up. So we had to do the cleaning. Well, I didn't do the cleaning, the vet did. So so the vet cleaned the teeth, and poor Lucy has some really bad cavities, so they had to extract a few of her teeth and did some bone graft on her and some surgical treatment. but she's a lot better now. So she's enjoying a healthier teeth, healthier mouth now. So I want to thank everyone for listening today, and I'm open to any questions if there's any. And here's my email as well if anyone have any questions that want to email me.
Thank you, Dr. Ziar. It's a wonderful lecture. You touch so many points and start from the disease, then oral health, the dental cares. It's a very wonderful lectures. Thank you very much. And I do get a lot of questions actually. Let's take a look at what they are, and let's go by one. So the most common things that they say, why is my teeth turn yellow, not white? That's a very general question. Yeah.
Okay.
And there's other questions say, my teeth feel like a very healthy, but it hurts when I'm eating ice. So yeah.
Okay, so yeah, so the first one, the teeth getting yellow. So two things. One, it could be either some staining from coffee or tea, from like an extrinsic staining. But even if there is no staining, over time, teeth always tend to become more yellow than when you're younger, because most of the color of the teeth are coming from the dentin, which is the second layer of the teeth. And as we get older, through wear and tear, the enamel, the top layer, gets thinner. So as the enamel gets thinner, then you are showing more of the dentin layer, which is the second layer. And that's potentially could be the reason why no matter how well you clean the teeth, if it's not staining, the teeth always tend to become more yellow as we get older. Now, the second question regarding sensitivity. So when your teeth is sensitive to cold things, the first thing you want to rule out is cavity. So the second you want to rule out is whether you have gum recession. Because when you have gum recession, some of the root surface are exposed, and root surface also have little tubules with little openings that connect to the nerve inside. And so when you have gum recession, teeth tends to be also a little bit sensitive to cold. And that's something that you, if you do notice that, you can address that to your dentist. And so there are different treatments that can be done to correct that. And also you can always use sensitive toothpaste, like Sensodyne is a great toothpaste to use for sensitive teeth. So the goal is to block some of the tubules. So when you have that opening that communicate to the nerve inside, fluoride, even saliva, like there are minerals in the saliva over time, can still block the tubules. Then the sensitivity will be reduced and eventually potentially be completely gone as well.
Very nice. So there's another audience that asked, what's the aging relate to the dental problem? Because he has when maybe she or he was young and the teeth look like very perfectly straight, and after the time by and getting crowded, what's the reason or what we should do to take care of those problems?
You mean like the teeth are getting crowded?
Yes.
Yeah, okay. Couple possibility. So one is, I don't know how old the person is. So if the wisdom teeth have not been removed, and as we get older, when the wisdom teeth trying to come out, if there's no space, then they will push the teeth in the front and cause some crowding. And also, if the wisdom teeth is already out and your teeth started to shift and get more crowded, partly could be because one, as you have less bone, then the teeth is more likely to shift, to move, and teeth always want to move towards the midline. So if you already have an overlapping teeth, the teeth will continue to push forward, and the rotator teeth or the crowded teeth is going to continue to get worse. So what you can do, if your periodontally health and the bone is stable enough, you can consider doing some orthodontic treatment like braces to correct the crowding. But after ortho treatment, you always have to continue to wear the retainer because teeth always want to move back to the original position. So retainer, I always tell my patient they have to wear it for life, even though the orthodontist sometimes will tell you wear it for a few years and then you don't have to wear them. But in general, I think you should always wear them forever.
Right. Very important. And we got some health maintenance problem. We have here any brands we recommend for the electric toothbrush. Also, how often we have to change the brush for, yeah.
Okay. What is the first question again?
What's the company brand we recommend for the electric toothbrush?
Got it. Okay, so I'll go with the second question first. So how often do you change the brush? So when you use electric toothbrush, no matter whether it's Oral-B or Flossing Care, I'm sure you notice that they have color on the bristles. So for example, on the Sonicare brush head, you have two colors. You have the green and you have the blue at the tip. So the blue basically is an indication of when you need to change the brush. So when you notice that the color, the blue part, the tip started to fade, and once it gets to about halfway, that's when you need to change the brush head. Now, as far as what brand do I recommend? So as most of the studies have shown, any electric toothbrush will work much better than a manual toothbrush. So if you already have an electric toothbrush, there's no need for you to get a new one if it's still working. But if you're looking to get a new electric toothbrush, both Sonicare, Oral-B, they both make a great electric toothbrush. Now, personally, because the shape of the Sonicare, it's more similar to a regular toothbrush. So for people who have never used an electric toothbrush before, they might find it easier to adjust. But basically, any electric toothbrush will work just
right. Yeah. Right. Also, somebody say they use a manual toothbrush is not feel like clean enough. So they feel like, but they also consider that electric toothbrush feel like it will damage the enamel. So what's the balance? Should I use an electric toothbrush or water floss?
Okay. So enamel is the hardest material in the body. Yes, you can wear off enamel, but it will take a lot of effort for you to brush away the enamel with a toothbrush. So when you use electric toothbrush, first you do not need to put a lot of pressure. So you just lightly leave the brush along the gum line, just slowly move from one spot, one tooth to the other, and that alone will not cause enough damage on your enamel. Now, should you use alternate between electric toothbrush and manual toothbrush? I usually tell people no, because the way you brush is completely different. So with electric toothbrush, you do not want to move too quickly. Whereas when you use a manual toothbrush, you do have to make that circular motion. You have to angle the toothbrush in a 45-degree angle. So it's kind of like when you play badminton, you don't play tennis because you use a totally different stroke. So by combining them, if you are not paying attention, you could be brushing incorrectly. So if you have both, my suggestion is to just only use the electric toothbrush, and you can disregard using the manual toothbrush.
Very nice.
Yeah.
That's most of the question. I got one more. Let's say sometimes he feel like he has a bad breath of the mouth. So I don't know is any way to get rid of it, and any suggestions how to detect the bad breath?
Okay. Usually when you have bad breath, it's coming from two sources. One is from the mouth and one is from the GI system. So most of the time, bad breath are coming from the mouth. And when there are bacteria causing the plaque buildup, and that will create some bad breath. Also, if you have cavity, that also can create some bad breath. So the first thing is to, one, visit your dentist to make sure you clean up all the teeth. So you remove all the plaque, all the calculus, all the bacteria. And on a daily basis, good flossing, good brushing, and use some over-the-counter mouth rinses afterwards. So you want to limit any bacteria in the mouth first. Now, if after all that and you still feel that you have bad odor, then it could potentially be coming from your GI system. Then you can bring that up to your physician, and so they can evaluate and see if you have any maybe acid reflux or but the first thing, usually, most commonly, bad breath are coming from poor oral hygiene.
Okay,